Medication Administration, Module 2. From the MAR, we are able to click up into the Medication Administration window by clicking on this icon, Medication Administration. This will open up the Medication Administration window. In the window, it says, please scan the patient's wristband. It is extremely important for patient safety that you scan all wristbands and all medications. Monthly scanning reports are done per department to make sure that people who scan are at a 95% or better average at scanning bracelets and medications. This is extremely important for patient safety. There is a next down at the bottom here to bypass the scanning. Again, it is not recommended that you do this. It is recommended that you scan the patient's wristband. Pick up your scanner and scan the wristband. This will open the Medication Administration window. In the Medication Administration window, you'll notice it is very much like the MAR. It gives you all the important details. You can right-click on the med and get information like order info. You can get reference manuals. So this information is very important and valuable when giving your medications. You can also do nurse review from this window if necessary. You must review all of your meds before giving them. In the Medication Administration window, you have all the patient's pertinent information. You have your sticky note icons so that you can review what each one of them has said. You also have your icons about rejected meds and meds that have yet to be verified by pharmacy. Again, you do not give meds that have been rejected or not verified by the pharmacist. All the way on the right, you have the details of the medication, the order sentences. The first medication that we're going to look at is Tylenol. So we're going to pick up our scanner and we are going to scan our Tylenol medication. Once we scan our medication, you will notice that it comes up here with details, and at the bottom here it says scan additional ingredients or choose a task to continue. You'll notice that our order is 650 milligrams or 2 tabs. The medication that we scanned was 325 milligrams or 1 tab. This is alerting you that you need to scan additional ingredients to equal the 650. So we will scan them again. This brings us back into the mall and it gives us a check mark here saying that we have scanned and we are ready to give that Tylenol. This Tylenol also comes with a sentence stating that this is only to be given for temperature greater than 38.1. So we would like to document that this was given. To document this, go into the results over here on the right under the result column, double click. This will open up the charting for this medication. In here, you'll see a performed on date and time, which is today and now. You'll see who performed this. Your name will be listed here. Next, you have med education purpose side effects given. We drop that box down. You will click on who you've given the education to. We're going to give it to the patient. Now there is a spot here for pain intensity, but again, the sentence says for temperature greater than 38.1. So we won't give this for pain, we will only give this for temperature. So if you needed something for pain, you would have to get another order. So we've taken our temperature orally, so we are going to put in 39.0. The rest of the fields here are all automatically filled in. There is an option down at the bottom here for not given. If by chance your patient says, I'm not taking this, you could click the not given and the reason. If there's parameters set on your medication, you could choose not within parameters, so on and so forth. So I'm going to uncheck that not given because we are going to give this. Then I'm going to say OK. The next medication that we are going to look at is the Metoprolol. For the Metoprolol, you're going to pick up your scanner and scan Metoprolol. Metoprolol scans, again with a check mark. We're going to come over here into the right because our order does say hold for systolic blood pressure less than 100. So we're going to double click in the right to open up the charting details. In the charting details, we'll see here it says performed on date and time, the RN, who we're giving the education to, and here at the bottom it wants systolic, diastolic, and peripheral pulse rate. So in here, we are going to check off the systolic blood pressure, again, greater than 100, and your diastolic blood pressure. No other charting details are necessary. We're going to click OK. The next medication we're going to look at is Digoxin. I'm going to pick up your scanner, scan your Digoxin. Now this one comes up with a blue circle with a white X through it. And over on the right-hand side, the results section is yellow, meaning that something is required within there. So we're going to double-click in there. I'm going to open this up, and we're going to notice that the apical heart rate is yellow. We're going to fill in the apical heart rate. We're going to drop down who we gave education to, and we're going to click OK. The next medication that we're going to give is the Dilaudid. We're going to scan our Dilaudid. Our Dilaudid will come up on the right-hand side in yellow. There's a blue circle with a white X, meaning missing details. Again, you have the option of clicking into any of your notes to see any information that you might need. Double-click in the yellow to open up the required fields. We're going to give education to the patient. Now here, again, we're going to read the order, and it says for severe pain, score of 7 to 10. So we would not document anything but something from 7 to 10. So we're going to say 9. We're going to drop down our site. We're going to say that it's in our left arm. Those are all the details filled in on your Dilaudid. You're going to click OK. Next, we're going to look at the influenza vaccine. Here we're going to pick up our influenza vaccine, our scanner. We're going to scan our influenza vaccination. We're going to go over to the right-hand side in the results, in the yellow required field. We're going to open this up. Now in this one, there's a lot more information that needs to be filled in. Besides the education, we'll need to look on the medication itself, find the lot number, who the manufacturer was, and the expiration date. The rest of this defaults in. We're going to give this in the left arm. I'm going to say OK. For influenza, we can right-click. We can go into Reference Manual. All the way on the right-hand side is a quick link to the CDC for the VIS form so you can give it to your patient. So you can do all of this within the mall, so it's very nice and handy. The next medication we're going to give is we're going to hang our sodium chloride. Now with IV bags that you get right from the Omnicell on the unit, you will scan the barcode that is directly on the IV bag. If you get an IV that comes from the pharmacy that contains another substance but the base solution, you will scan the barcode that the pharmacist puts directly on the bag. So we are going to scan our sodium chloride. Comes with a blue circle with a white X. We are going to click in the details, results on the right-hand side. It's going to open up the Begin Bag screen. We're going to drop down the site where we're starting this, and we're going to click OK. So this is all of the medications that we're going to be giving in the medication administration window. As you'll notice, we have not gone near the Cardizem or the Lasix because both of them have not yet been reviewed by the pharmacy. So now what we're going to do is we're going to sign. This will bring you back out to the MAR. You can refresh to see that your medications have been given. This concludes Module 2.